Nigerian Medical Association (FCTA) is proposing an extension period for the disengagement of the public-private partnership arrangement between the Federal Capital Territory Administration and the current management of the Garki General Hospital, Abuja. They believe this will give room for a more effective, smoother and more humane transition for both the patients and more than 900 medical personnel that could be affected. Kemi Balogun has more.
Since the 1st of March this year, reactions have continued to trail the notice served to the management of the Garki General Hospital by the Federal Capital Territory Administration to vacate and hand over the facility. An agreement signed between the duo in 2007 has now elapsed after 15 years, but the ripple effect caused by the suddenness of this disengagement order has been termed as ill-timed. Today, the Medical Association, who are at the verge of losing hundreds of jobs, are lending their voice to this issue, calling for a reconsideration to the time frame given so that no one is left behind.
If there's a debt to be paid and is a reason for the termination notice, I'm sure they can sit down and come to some form of agreement. Because if you rent somebody's house, you're supposed to pay rent. And so, but my worry now is the tenants who have been working assiduously in the last 15 years in that facility, who have been holding forth when all the public hospitals have been on strike. And we all know that when all the public hospitals are on strike in FCTA, Garki Hospital still works, still functions. And all of a sudden you're asking them to pack their bags and go home within a short period.
I don't think 1 month is reasonable notice for a facility of that nature. And that even if it is also part of the agreement, looking at the facilities, we feel that using self-help will not be advisable. Because what happens if at the end of 1 month they are unable to evacuate?
The group also wants the federal government and the Nigerian National Petroleum Corporation to look into the present fuel crisis happening in the country in order to lessen the burden on doctors.
The situation has severely affected the practice of medicine. Health workers are now finding it increasingly difficult to get to their places of work to discharge their duties, not to mention the adverse effects on productivity.
Lawmakers on Thursday had resolved to ask the FCTA to stay action on the termination of the concession agreement, pending the intervention of the committees on privatization, commercialization, and health institutions on the matter. More than 100 doctors and thousands of patients could be affected if the FCTA goes through with the vacation order. Kemi Balogun, TVC News, Abuja.